What is the history behind oral motor exercises? Imagine trying to build a house without a solid foundation. That's similar to how speech therapists viewed oral motor exercises in the past. These exercises are movements like lip puckering, tongue wagging, blowing, and stretching, aimed at strengthening the muscles used for speech and feeding. They started in the early days of speech-language pathology as a way to help children and adults with speech, sound, and motor disorders. The idea was that if you could improve muscle strength and coordination in the mouth, speech would get better. In the beginning, therapists believed that practicing these non-speech movements could transfer to clearer speech. They thought that by making the muscles stronger or more flexible, speech production would naturally improve. This approach was popular because it seemed simple and engaging, especially for children who might find traditional speech practice frustrating. These exercises were often used to warm up or prepare the muscles before speech therapy sessions. Over time, the use of non-speech oral motor exercises became widespread. But as more research was done, some questions arose. Experts started to wonder if these exercises really helped with speech clarity. They pointed out that speech is a very complex activity involving precise coordination of many muscles. Simply strengthening or stretching muscles without practicing actual speech sounds might not be enough. This led to debates within the field. Some clinicians argued that non-speech exercises could improve oral motor skills, while others believed that speech-specific practice was more effective. As a result, newer approaches emerged that focus on practicing speech directly, using sensory feedback and motor learning principles. Techniques like dynamic temporal and tactile cueing and prompt therapy are now preferred because they target the actual movements needed for clear speech. Despite the controversy, many speech-language pathologists still include oral motor exercises in their work. They often use them to help with feeding, swallowing, or sensory issues, alongside speech therapy. The history of these exercises shows how understanding has evolved. Today, the emphasis is on functional, speech-related activities rather than isolated muscle exercises. This shift helps ensure therapy is more effective and relevant to real communication needs.